Hi, Dr. Martin. Thank you so much for calling me back. This is Kelly. I'm the registered nurse taking care of Mrs. Smith in room 404. Are you familiar with her? Okay, well, Mrs. Smith is a 36-year-old white female patient. She weighs 130 pounds or 59 kilograms. She has no known drug allergies. She's a full code. Her chief complaint is that she came in with a general feeling of not feeling well and a wound she sustained to the left forearm. History of present illness. Mrs. Smith is a 36-year-old female patient. She is a full-time mother to two children, ages 6 and 8. She was at home 5 days ago cooking dinner. She was chopping vegetables. The kids were running around. She turned around and the knife slipped, and she sustained a wound from the knife to her left forearm that wasn't very deep, and she stated that it was superficial. She said that she did clean the wound with some warm soapy water and applied gauze dressing to it. Over the last couple of days, she said that the wound started to increase in redness and a little bit of warmth, and the pain started developing in the area. She stated in the emergency room that it was a 2 out of 10, but what really brought her in was this general feeling of just not feeling well. Her past medical history, she has no past medical history. She has no past surgical history. Social history, occasional glass of wine, maybe 2 per month. No recreational drug use. Medications, she only takes an oral birth control daily. In the emergency room, her vital signs was she had a temperature of 99, a heart rate of 90, a respiratory rate of 22, a blood pressure of 110/70 with a mean arterial pressure of 83, and an oxygen saturation rate of 94 on room air. At that time, she was admitted to the hospital as an observational patient. When she arrived on the unit, her vital signs were the same. They remained unchanged. She was awake, alert, and oriented ×4 on arrival. Her physical exam was unremarkable, with the exception of that general not feeling well and the area where she sustained the wound. Again, the wound was red to the area, and there was no oozing or any discharge coming from the area. There was some slight pink at that time, and that was all. Her current vital signs are 101 degrees Fahrenheit, a heart rate of 102, respiratory rate of 24, blood pressure of 88/42 with a mean arterial pressure of 53, and an oxygen saturation rate of 94. General appearance, she is resting comfortably in bed. She is pleasant. She is not in any moderate distress. She just states again that she just wasn't feeling herself, and I could see that there is a change in her appearance. She came in, again, not feeling well, but she seemed a little bit more awake, a little bit more happier than what she is right now. Neurological, she's awake, alert, and oriented to person, place, and time. Situation was slightly off. She stated that she did remember coming into the emergency room with complaints of just not feeling well, but she did not remember the wound that she sustained to the left arm with a knife. Once they reminded her, it seemed to have ringed some bells, but it still, to me, felt like it was a little fuzzy for her. Cardiovascular, normal S1, S2. She does have a normal rhythm, but as I said, she was tachycardic. She had no S3, no S4, no murmurs, gallops, rubs. Peripheral vascular, she did have +2 pulses in all extremities and a 2-second cap refill also in all extremities. Her respiratory rate, her lungs were clear throughout. She had no shortness of breath, no difficulty of breathing. GU, she does have a decrease in urine output. She only voided 200 milliliters in the last 8 hours. Her I's and O's at this time since admission have been 1,000 liters in and 200 out. She stated that she had no difficulty voiding, no urgency, no discomfort, no signs of bleeding. GI, her abdomen is soft, non-tender, non-distended, positive bowel sounds in all 4 quadrants. She is currently on a regular diet, and from what I have seen in her chart, she has been eating just fine. She did have a bowel movement earlier today. Her skin is warm, dry, and intact throughout, with the exception of the wound. The wound area has increased in redness. It is more swollen to the area. On touch, on palpation, the pain has increased from a 2 to a 6 out of 10. The IV site is clean, dry, and intact. And as I said, as far as her pain is currently a 6 out of 10. As far as her blood work goes, currently she does have blood cultures, 2 peripheral blood cultures, which are pending. Her B1 and creatinine are 6 and 1.2. All of her other blood work is within normal range, with the exception of her white blood cell count. Currently, her white blood cell count is 12,000 with 2 bands. So I'm concerned because I feel that this patient is meeting the criteria for sepsis, and I believe she does meet the protocol, the requirements for us to start the protocol for sepsis on this patient. Yes, I am ready to take some orders. Yes, she does have an IV. The IV site is clean, dry, and intact, and currently she has normal saline running at 50 mLs an hour. Okay, yes. Okay, we will give her 2 liters of normal saline, each liter over an hour for a total of 2 hours. Blood work, okay. Blood work to add, okay, we will add on a PT, PTT, and lactic acid. Okay, next, okay, vancomycin, 1 gram IV right now. Okay, yes, I will do that. And how long would you like that to run over? Okay, in 1 hour. Wonderful, thank you. Okay, so if I can make a suggestion, after we give her IV bolus of the 2 liters, I would like her to be reassessed for the possible use of vasopressors. And if she does not improve after the IV fluids and the initial treatment, I would like her to be considered to be moved to the ICU, possibly for further evaluation or for monitoring for the sepsis. Okay, and you will come down and assess her as well? Perfect. I will see you in a few minutes. Thank you so much.